excess toxins can help to increase energy levels and keep you going strong throughout the day. Detoxification can also help with long-term weight management by removing the toxins that are currently interfering with proper metabolic function and helping to set you up with healthy habits. If I have stirred your curiosity, then join us on our Nature Scanner for more on the issue. Hello and welcome to Health Options. I am Rabi Abdullah. Thanks for joining us on the program. Most countries that have made appreciable progress towards universal health coverage implemented some form of government-led health financing reforms. Nigeria has aligned itself with the global push for universal access to quality health care devoid of risk of financial catastrophe. However, the country faces challenges that delay progress towards the attainment of the federal government's declared goal of universal health care. One of such challenges is system-wide inequalities resulting from lack of financial protection for the healthcare needs of the vast majority of Nigerians. Only a small proportion of Nigerians have prepaid health care. The emergence of a new leadership for the scheme is, however, expected to change the narrative. That's why on the policy track segment of this episode of Health Options, we take a look at what is new in the country's journey to universal health coverage, talking about fast-tracking the process as Nigerians continue to keep fingers crossed to when all and sundry can access health care in the country without having to think about the size of their pockets. This is Health Options, and we begin our policy track segment, and our focus is fast-tracking Nigeria's journey to universal health coverage. And here in the studio to take us through the topic is the Executive Secretary of the National Health Insurance Scheme, Professor Muhammad Nasir Sambo. Glad to have you in the studio, Professor Sambo.
Thank you very much for having me today.
Yeah. Yes. The moment you were appointed, what was that resolve within you that when you got there, this is what I must make happen?
When I got to NHIS, I came with 3-point agenda. The first one has to do with ensuring stability in the organization. Number 2, to undertake a reform that will ensure transparency and accountability. And the third one is to put a clear framework for accelerating attainment of universal health coverage, which is the global topical issue now. The universal health coverage has to do with ensuring people having access to both preventive, promotive, curative, rehabilitative healthcare without undergoing any financial hardship. The law establishing the health insurance has not been provided for the informal sector program. Private and public sector organizations that have a staff of up to 10 and above personnel, they are the ones that are supposed to join the health insurance, and up till today that law has not changed. And if you have a situation whereby only the federal government, the law is so restrictive that it's just addressing the formal sector group, and the state have refused to join, the local government have refused to join, so you are now have a situation whereby only the federal government staff that are mandated, and they are the only people that government is giving contribution on their behalf.
If you look at the percentage of coverage, is really nothing to write home about.
Yes.
Yeah, we know there had been issues of leadership, and some other factors that probably stagnated, the progress, of our scheme. But right now, we could say we've put all of that behind us. I've heard so much about some sort of reforms we are bringing on board. Something like, I think one of them is the health insurance scheme under one roof. Yes. Nigerians will be interested in knowing what this is all about.
Okay. If the state refused to join the health insurance, and later on there was a National Council on Health which now mandated states to develop their own state health insurance, because the desire is to ensure coverage. Since they could not join the National Health Insurance Scheme, they were now allowed to establish their health insurance.
So how many of those states have you been able to secure their buy-in now? Or is it the whole?
Yes, now when we came and brought this concept of health insurance under our roof, we did a lot of advocacy, interpersonal interaction with the states and other policymakers, including the international agencies, so that we can now come together and have what we call health insurance under our roof. There should be some common binding force that will hold all the health insurance together in form of coordination, aggregation of data, ICT platform. We can generate information as to how many people are currently enrolled into the health insurance ecosystem, and we can have guidelines that will facilitate working together, as well as defining some identifying areas that are cross-cutting in nature, and also allowing the state to also do their own running their health insurance without undue interference with the federal social health insurance.
Okay, the basic health, provision fund. With its rollout, what difference are we seeing? The difference expected, of it so far
through the National Health Act, which was signed into law and gazetted in 2014. It was recommended that 1% of the total budget consolidated money from consolidated revenue account will go to the healthcare delivery system, out of which half of it, which is 50% of the 1%, will go to the National Health Insurance Scheme.
That's the basic health provision fund.
Yes. Now. Half will go to the National Health Insurance Scheme. The one that is going to NPCDA will allow primary healthcare facilities to be upgraded so that they can provide the quality care that is required. Whereas the National Health Insurance Gateway will now, the money will be used in identifying the vulnerable segment of the population so that premium can be paid for them to access healthcare delivery services. So what we have done so far, we have received the first tranche and we have disbursed them to the state. The mechanism of action of this basic healthcare provision fund is the money that is coming to the National Health Insurance Gateway will be distributed to the states. And the state are the one that will identify the vulnerable segment of the population and purchase the services to them. We have started actually seeing the impact. One, because most of the state social health insurance schemes are just coming. And that money, because of that money, they have quickly organized, most of the states have given their own counterparts, which they now used to setting up the structure, state health insurance structure. And some of the states, with the money we have given them, they have started enrolling the beneficiaries. We have developed a template whereby information will be generated so that we track whatever states are doing with that money in terms of enrollment from the National Health Insurance Gateway.
How far have you gone with the re-accreditation of HMOs?
Okay. The HMOs, they are health maintenance organizations. They are like third party whose functions are essentially to collect the money from the NHIS, ensure that individuals are enrolled, and they pay healthcare facilities for the number of people and services they have rendered. They are supposed to be accredited by the National Health Insurance Scheme periodically. So before I came, there was an accreditation exercise which has lingered for more than 1.5 years, and the results has been analyzed. So when I came, I reviewed all the situation, and I realized that even despite the fact that the exercise has taken so long, but it was not completed, and I tried to find out what was the reason. I was told that because of the instability and because there was no board and so on and so forth. But when I reviewed I say that instead of us to start another journey, but we can complete that process, and when we complete that process, we can initiate another process.
So you are in the process of continuing,
in fact,
completing it?
No, in fact, we have finished the process.
Okay.
I took the result of the exercise, we reviewed them, and we now send to the Honorable Minister. And the Honorable Minister has approved the finding, out of which 8 HMOs out of the 50-something that have come for the registration have gotten a clear pass.
That's 8.
8
out of 50.
Out of around 50.
Over 50. Okay.
Over 50, and around 40 they were given provisional accreditation. Some issues have been identified with their standing, which they ought to correct within a period of 3 months. Otherwise, they will now go into the delisting. And one of the HMO was outrightly delisted because it has not fulfilled all the criteria that is required. So that is the situation now.
Well, how are you resolving issues now?
Yeah,
because the enrollee just wants better service delivery.
We took the entire management to a retreat. We unravel what are those value systems that have been affecting the performance of the health insurance, and we were able to package all the problems in like 10 domains, which has to do with issues that has to do from working environment, from issue that has to do with equity, justice, proper record system, and we have identified those in 10 domains, and we have started implementing the recommendation as a fallout of that retreat.
So it will be right for Nigerians to look forward to the fast tracking of universal health coverage. What are you doing in terms of expansion of coverage for treatment?
One of the major concerns that is very recurring is the issue of non-payment of providers by health maintenance organizations, or delay in payment of capitation and fee-for-service by the HMOs. We have been able to resolve that by 1st January of this year.
Okay.
What we did is that we now change our mode of payment from a monthly payment to a quarterly payment in advance, so that no HMO can now come and tell us that because NHIS has not paid him, he is not paying the healthcare facilities. And there are other reforms that we are currently institutionalizing to better the way the formal sector is being operated. Then, with respect to the innovation, is what are the segment of the population that are not currently covered?
Retirees,
students, NYSC.
Yes.
So we have developed what we call a matrix of cover under the health insurance in Nigeria. We look at different setup of our society, the formal sector, the private sector, the people with disability, the NYSC group, university students, retirees, women and children, the elderly, the people, the refugees, and so on and so forth. We have developed that comprehensive matrix. And what we did is that we now agree that for us to achieve universal coverage, all this segment of the population will have to be covered. Yeah. If you see any health insurance across the world, it's either people are paying or government is paying. Or some other people are also some other means of payment is coming.
The National Assembly had promised to really work on the, what do you call it?
Mandatory.
The Act.
Yes.
You know, the amendment of the Act.
Yes.
They had given their words that they will do that.
Yes.
And also, are you in tandem with them towards fast tracking that?
Absolutely.
Because it means a lot.
Absolutely. If there is no mandatory health insurance, the NHIS will not be able to perform its bigger role. So if you make it a mandatory, it therefore means that every public sector and private sector will put the monies for their workers in the health insurance fund. And the survival of health insurance fund is always based on the level of buoyancy of the fund. Now, if you have all the monies that are coming from the public sector and the private sector will not allow you to cover the entire Nigerians. That is where the role of innovative healthcare financing will come in. So when we stratify the population, the formal sector group, they are covered through their salaries. Some proportion of the population will be covered through the provision of basic healthcare provision fund. But you still have a gap, and that gap has to be bridged. If we are to have this universal health coverage, we are working with a lot of partners.
Towards that?
Towards how do we bridge that gap? Okay. We are working with a group of D8, Developing Aid is one of the international organizations who is working on innovative financing, on how to mobilize funding for us. There has been an approval by the government for some years back for NYSC student to be enrolled in the health insurance, but that has not been taken off. I paid a courtesy call to the DG of NYSC, and we have agreed. We set up a technical committee who is now working, who has finished their work, and we are now making submission to the federal government so that NYSC group can also be covered. So we are working to see various ways in which we can cover the various grouping and expand.
Okay, so how while you are working towards all of that, are you equally keeping track of the way enrollees are treated at health facilities in terms of quality of services rendered to them? Yeah, I hope you are keeping track of that.
Yeah, we are. You see, there has been so many complaints, and these complaints are systematic issues. They cannot be addressed in isolation. For example, our enrollees that are being turned back because payment has not been made to the healthcare facilities. How do you resolve it? You change the payment system, just the way we have changed the payment system. And with that now, no any excuse should be given that there is no payment or there is delay in payment.
You've changed that?
Yeah, we have done that. Okay. And another area that we are working on is the issue of authorization code. An enrollee has gone to his primary healthcare provider. He wants to he is seeking for referral. It will, by the current guideline of the National Health Insurance Scheme, it will take 24 hours. What of in the case of emergency? If you have an emergency situation, will that case has to wait for 24 hours? We now say, we will first of all reduce the time from 24 hours to 6 hours. That within 6 hours, every HMO must give a referral authorization code to an enrollee. We want to establish call center so that it can connect all our state offices. A call can easily be issued so that that person can be given authorization code by our state office, so that within 6 hours he can get to receive services. But I discovered that out of more than 1,400 staff that we have in the National Health Insurance Scheme, only 55 are healthcare professionals. Only 22 are doctors. And if I am to implement that decision, and I don't have at least one doctor, in fact, I need like 2 doctors in every state offices, so that if one is not available, you have another one that can give authorization.
That's job for medical doctors out there who are jobless, if you ask me.
Yeah, part of our strategic and short and long-term plan, and if we are to correct all those anomalies, we have to undertake that. We have to ensure that every state office has at least 2 medical doctors, 1 pharmacist, 1 lab scientist, so that at any given point in time, authorization code can be issued, and if there is any quality assurance issue, they can quickly step out to investigate and take remedial action. All those things are not currently on ground, but we are working assiduously to see that we have controlled that, so that people will continue to see improvement in the healthcare services within the health insurance domain.
Okay, thank you so much, Professor Muhammad Nasir Sambo, for coming on Health Options. Regular bowel bowel movement and emptying the bladder at the right intervals no doubt promote healthy living. But experts say that's not enough to rid the body of impurities, and I quite agree with them. More on what you need to do to rid your system of toxins as we take you over to our Nature's Corner.
Detoxification is a process by which toxins are gotten rid or made into simpler form that the body can get rid of. God created the body in such a way that it detoxifies itself through the organ of the liver and kidney and other that are involved in detoxification. Toxins accumulate in the body through food, drugs that we take. There are various ways that we are exposed every day to toxins. For example, the use of GMO foods. In fact, some of our food products, during preservation or one way or the other, they are contaminated. We heard about using snipers, even in preserving beans, grains, and other chemicals that are very hazardous to the body. Most of the water, even you can smell it yourself. High level of chlorine. Fluoride is in the everyday toothpaste that you use. The teeth amalgam, for example. It was a safe procedure before to fill in your teeth with mercury. And now it has been discovered that mercury is very, very toxic to the body. You cannot imagine 1 out of every 10 person has one tooth filling or the other. And that shows how directly or indirectly this mercury is being dropped into your body. Most of the food that we buy in the supermarket, they have additives that are found to be poisonous. A lot of anti-GMOs have been campaigning, but due to one reason or the other, there is nothing you can do. Our cosmetics, especially as women, is it our hairspray, where our skins and pores, they enter into the bloodstream. And at the end of the day, all this accumulates. When chemicals continue to gather beyond the rate at which the kidney and the liver can naturally take care of them. You can imagine our environment. The air is so polluted. The environment is so dirty. No matter how clean your inside of your house is, you have to go out. And getting outside, the dust, the exhaust from so many pipes, the waste. And by the time they get accumulated, and your body is so exhausted, the liver goes through this process. Before you know it, disease state starts setting in. And this occurs at all levels. And then you start having all sorts of symptoms that you cannot even explain. You can use herbs to detoxify. Example is the turmeric, the garlic, the green tea. We have rosemary, lemon juice. All these can be used, but caution must be taken. That is why once in a while, there are already NAFDAC approved supplements that can actually help you. Putting in place diet and combining the two of them together, you can actually use it once in a while to see whatever the accumulated toxins in your body, you help the liver and the body system to get rid of them. And this can actually be done maybe like twice or thrice in a year. It's not every time that you say you want to detoxify and you start taking something that will purge you, something that can sometimes even be harmful.
And this is where we end this week's episode of Health Options. Remember that you can go to our YouTube channel to watch the upload of this and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdallah. Hope to see you again.